hello everyone, good morning. So welcome to the National Nephrotic Syndrome Patient Day 2017. So my name is Wen Ding. I'm a pediatric registrar and a clinical research training fellow here in Bristol Renal. So I've been asked to introduce nephrotic syndrome today, and hopefully we'll do it in a nice gentle way as a start to this day. So what is nephrotic syndrome? So in order to talk about nephrotic syndrome, we have to talk about the kidneys. And the kidneys are these two bean-shaped organs that sit at the back of your abdominal cavity. The function of the kidneys is to produce urine and to allow you to get rid of any waste products from your body. In order to do this, the kidneys need to act as a filter. In nephrotic syndrome, what happens is this filter breaks down, the kidneys start to leak protein, you find that you've got protein in your urine, and patients tend to describe a swelling or puffiness. In children, this tends to be around your eyes, and in adults and children alike, you tend to get puffiness around your ankles and your legs. So when you have high amounts of protein in your urine, you get low amounts of protein in your blood, and this can lead to some complications. So those with nephrotic syndrome tend to be predisposed to blood clots, infections, and a high amount of lipids in their blood. So who tends to get nephrotic syndrome? So we find that about 1 in 50,000 persons per year get nephrotic syndrome. Boys tend to get it more than girls. The most common age group to get nephrotic syndrome between ages 2 to 5 years, but anyone of any age can get nephrotic syndrome. It's more common in Asians as well. So how do we classify nephrotic syndrome? So those of you with nephrotic syndrome have probably received high-dose steroids at some point in your disease journey. We can classify patients according to whether they respond or do not respond to steroids. So if you respond to steroids and your protein in your urine disappears and you feel better after 8 weeks of steroids, you're classed as being steroid sensitive. This subgroup comprises about 80% of children with nephrotic syndrome. About half of these children will never ever have another episode of nephrotic syndrome again in their life. The other half will have one or more episodes, and we generally find that as children grow older, they tend to grow out of their disease. The other subgroup are those with steroid-resistant nephrotic syndrome, and this means that after 8 weeks of high-dose steroids, you haven't responded to steroids, there's still protein in your urine, or you're still puffy from the disease. So this group comprises about 20% of children with nephrotic syndrome, and in adults this is slightly higher, about 40%. There's also a very small subset of patients who have initially steroid-sensitive nephrotic syndrome, but as their disease progresses, they switch to become steroid-resistant. So some of you with nephrotic syndrome might have had a kidney biopsy at some point in disease where we've taken a little bit of tissue from your kidney. And if you have steroid-sensitive nephrotic syndrome, chances are we've seen something called minimal change on your kidney biopsy. And if you have steroid-resistant, we've seen something called Fsgs on your kidney biopsy. And what I wanted to do today is show you some pictures of these changes, as you've probably received results but might not have seen the associated pictures before. So in order to do that, I need to show you a very important cell in the kidney. So this cell is called the podocyte. And as you can see, so this is the podocyte, the orange cell. That center bit is its cell body. It looks a little bit like an octopus. So it's got that central bit, and then it's got lots of protrusions coming out of it. So these protrusions divide over and over again, okay, so if you go down one of these protrusions, you can see they divide and divide and divide until they form really small little processes. So I'm afraid I'm going to have to ask you to do an exercise today. So can everyone put their hands up in the air? Right? So imagine your fingers are the foot processors, okay? So if you take your fingers and you interlink them like this, okay? So can you see those foot processors from different cells are interlinking. Now if you turn it and have a look at that, you should see some holes. So these holes are what forms the filter in your kidney and enables the kidney to prevent leakage of proteins. So it's really important that your podocytes are healthy in your kidney and to prevent the protein from leaking out. Okay, so if you turn this round this way and you chop through it this way, then this will take us on to the next picture of the podocyte. So you can see these foot processors are really regularly spaced over here. So you're looking at them from end on, and this is what it looks like on a normal picture on normal microscope finding. Okay, so your blood is down here, and blood is pushed across this barrier, this filter, and this turns it into urine. Right, so in minimal change disease, which correlates roughly to steroid-sensitive nephrotic syndrome, so this is the normal podocyte we saw before, and in disease you find that the filter has become very disrupted, and this is what it looks like in disease. So it's become sort of more of a splodge, and so it doesn't function as well as a filter, and you start to leak protein. So the other biopsy finding you find in nephrotic syndrome is called Fsgs, or focal segmental glomerulosclerosis. So this is correlated with the steroid-resistant form of the disease. So this is a different sort of microscope picture, and that's what a normal filter looks like in this sort of picture. In Fsgs, what happens is you get these blue deposits, and these blue deposits are collagen. So collagen is really good for your skin, but really, really bad in your kidney. And if you have Fsgs, this is what happens, and this leads to protein in your urine. So what causes nephrotic syndrome then? So we've talked about steroid-sensitive and steroid-resistant forms, and across both forms, we think there is a circulating factor in your blood that could be responsible for the disease. Some children and adults with steroid-resistant nephrotic syndrome have a genetic form of the disease. So if we talk about the genetic form of the disease to start with, so the first gene in nephrotic syndrome was identified more than 20 years, just under 20 years ago now, in 1998, and this was a real landmark finding. Now, about 19 years later, we know that there are more than 50 genes implicated in nephrotic syndrome, and this is all down to all of you donating your blood and allowing us to study it, and it's through that we've managed to find all these genes, and Aga, one of my colleagues, will talk to you more about this, the genetics of nephrotic syndrome, later on today. So the circulating factor theory, why do we think there's a circulating factor causing nephrotic syndrome? Some of you might have had a kidney transplant for nephrotic syndrome, and we know that about half of patients who have a kidney transplant for nephrotic syndrome will have their disease recur. That means their nephrotic syndrome comes back. What we think is happening is, so if you think of this as your new kidney transplant, it's doing really well, producing urine, and there's no protein. And we think that there's a factor in the blood that comes along and attacks the new kidney, which then causes it to not function effectively anymore, and the nephrotic syndrome comes back again. So some of you might have had plasma exchange after transplant, and you might have donated plasma to Nephros or to another study. And we've come a long way in understanding the circulating factor because of the plasma that you've donated, and we've identified some targets that might be potential targets for therapy, which has been amazing. So the ongoing research at the moment, so Nephros you'll hear about a little bit later. I think Liz Colby's going to talk about it. And Prednos 2, I think Helen Sumner's is going to cover that later. Here in Bristol, we've done a lot in the lab upstairs for nephrotic syndrome, and things that we're looking at the moment include looking at therapies for genetic nephrotic syndrome. We're looking more closely at circulating factor disease, and we're also looking at specific genetic mutations and how these work, sort of thinking about personalized medicine for the future according to what mutation you have. So hopefully I've given you an overview of nephrotic syndrome. There's a lot more information online, and these are a couple of websites that have good information on nephrotic syndrome.